Hi, my name is Eva Steiner, and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to... Thank you for taking this time today for doing this interview with me. Before we start, can you tell me a little bit about yourself?
Sure. Thank you so much for having me, Ava. I'm really happy to have this opportunity to talk with you. My name is Aisha Kamal, and I'm currently a psychologist practicing out of Kuwait. Although I'm not Kuwaiti, I have lived here my whole life. I was born and raised here. Originally, I'm from Bangladesh, but this is basically my home.
Tell me a little bit about your culture. What is some holiday or tradition that your country celebrates? And if your culture would be an emotion, what emotion would it be?
So it's so interesting whenever I have questions about culture because I come from such a multicultural background. Again, as I kind of started with my introduction, by nationality, I'm from Bangladesh, but I've been living here. So when I think about culture in the context of Kuwait, I'm thinking about being an expat worker living in Kuwait. One of the things that I think about is this concept of home and identity and belonging. Like, what does it actually mean? So when I think about holidays or traditions in Kuwait, the first thing that comes to mind for me is the Kuwait National Day and Liberation Day, which are February 25th and 26th. And I think that these two holidays really stand out for me because it's a chance for the people here in Kuwait to really celebrate the country that we're living in, remember the privileges that the country affords us, and just kind of reflect on the experience itself. And I think one of the unique things is that most countries have a national day. So for Kuwait, it's February 25th, but it also has this Liberation Day, which is February 26th. And that marks the day that Kuwait was liberated after the Iraqi invasion in 1990. So for me personally, that was a very interesting, challenging time in my own history. But I think it also kind of tells the story of resilience and growth and development. And so those are really pivotal dates for me. So for your question about Kuwait being tied to an emotion, I had to think about this one a little bit, and I came up with the emotion of hope. So Kuwait is still a relatively young country with getting its independence in 1961. So, we're still kind of finding our identity and figuring out what the trajectory of growth is. And one of the things that I noticed, and this is actually something that I researched during my doctoral thesis, was how we try and balance tradition and modernity. I looked at how identity is developed, particularly through language learning, so learning English and the impact of globalization. And one of the things that I noticed during my research, but also that's been coming up in the therapy room, is that this balance is not easy to achieve. But what I've seen is that people have hope that they will find something, that they will find an identity, they will find this sense of belonging. We don't have to be in conflict. It doesn't have to be that I'm traditional or I'm modern. We look for finding this balance.
Well, you mentioned this searching for home or belonging, living in a foreign country myself. It is a topic that comes to me often, and I see it with my clients a lot. I can relate to what you were saying earlier.
Yes, it's definitely a trend that I see. And I think what's actually interesting is that this is also relevant for Kuwaitis themselves, right? So they're trying to figure out, as the country is figuring out what is its new culture, how are things changing, so are the people, right? Especially the newer generations, they're trying to figure out, who am I and how do I fit in? How do I balance what it is that I want when it may be not exactly what my family wants or what culture dictates or what tradition dictates. And so I think one of the interesting things is, how do we find this balance so that we're not going tradition, as I said before, tradition versus modernity, but actually looking to see how they can be in sync.
In the pre-interview, you also mentioned weekends and different dates for weekends. Can you just share a little bit about that?
Sure. Actually, a long time ago, I'm talking maybe 20, 30 years ago, the weekends here were Thursday and Friday. And then maybe about 15 years ago, don't quote me on the dates, I'm not sure, but then we changed to Friday and Saturday. So because Kuwait is a majority Muslim country and Friday is the day of prayer, Friday has been given a holiday for everyone. And then we just kind of shifted to Saturday as well.
Sure. Okay, so let's move to the second question. How did you become a psychotherapist in your country, and what is your psychotherapeutic approach?
Well, from a young age, there were two things that I was completely drawn to, and that was being a teacher and being a psychologist. So I spent actually the first 20 years of my career as an educator. I started by teaching English in the States, and then I moved to Kuwait and taught English at Kuwait University for 14 years. So after I did that, and I got an opportunity to work with these older adolescents and younger adults, I kind of realized that, oh, I'm a bit interested in shifting fields. So I went back to school and I became a psychologist. And so I'm a relatively young psychologist in that I've only been practicing for 3 years. So I think I'm still trying to figure out my exact therapeutic approach, but I would probably say that I follow more of an integrative approach, drawing mainly from person-centered therapy and psychodynamic, just kind of like that flexibility of being able to shift along with the clients to see what it is that they need and drawing from other modalities as needed, whether it's CBT or DBT. But it's mainly just kind of being present in the room and seeing how I can support the client in that moment.
In general, in Kuwait, how do you become a therapist there?
It kind of depends on whether you're studying here in Kuwait or you're going abroad. So there isn't actually a procedure, for example, there's no licensing board or anything. Instead, like whatever degree you get, it's verified by the Ministry of Higher Education. And then it depends on where you want to work, whether you're going to work in the government sector, they're going to have different policies. Or, for example, I work at a private clinic and they have their own hiring policies as well. So each organization will differ. There's no one straight path.
And do they distinguish between psychology and psychotherapy? Are these two separate professions or they are bound in one?
That's a great question. I think overall it's still kind of bound in one. And I believe we're going to see this change a bit more as the field of psychotherapy grows more in Kuwait. I've definitely seen it grow a lot in the last 15 years, but there's still kind of adopting different like philosophies, figuring out the licensing, and also if there's going to be just a general board that's going to look at the ethical guidelines, that's going to look at hiring practices and qualifications. So I think we're headed in that direction, but there's nothing specific as yet.
You mentioned governmental organizations and private clinics. As a client, how can I get help? Do I need to pay privately or can I get it through health system or through some organization? How does it work?
Actually, people will have options. For the government sector, pretty much anyone who is a resident here in Kuwait, they have access to that, and it's almost free. I think there's a very nominal amount that needs to be paid more as a registration versus treatment. And otherwise, they have the private organizations in which there is a fee depending on what the organization is. There are some organizations who will, so they're not actually clinics, but maybe just general social groups. They may provide like therapy sessions or outsource and have a relationship with other therapy clinics. So I guess there are a variety of options that people can choose from.
How popular this profession is?
It's growing in popularity. One of the challenges is not having a regulatory board where there is this set system. So it may be a little bit confusing as to how to get started. However, just in the last 3 or 4 years, I think there's been a really big growth in this industry. So a lot of clinics are coming up. A lot of people are interested in pursuing. I sometimes wonder if this was kind of a push because of the pandemic when people really became aware that mental health is important and we need to find ways of supporting ourselves or supporting our families. So I think that it's moving in this direction where it's going to become more popular, and there's definitely a need. So right now, there are many Kuwaiti psychologists and psychiatrists, and there are also many expat counselors as well.
How society looks upon psychotherapy or any psychological help?
So having lived in Kuwait for over 30 years, being that I'm so interested in psychology, I'm really happy to say that I think the overall attitude has been really moving towards accepting psychological help. It's not being seen with so much of a stigma. Yes, there is a little bit of a stigma still there. People are a bit hesitant to go to a therapist, but I think that it's really, really changing. And I would say that our clinic is always full. There are always people who are coming in. So that in itself, and showing that there's a demand, there's a need for it, is showing that people are becoming more and more open. I sometimes wonder if we're just used to saying that there's a stigma against mental health. Again, there is a bit of a stigma, but the evidence is kind of showing that people are ready to talk. I definitely think social media has an impact because people are more aware that, oh, this thing which I thought was, something that's negligible, maybe I do actually need to speak to someone about it. That's one thing. The other thing is, so I work as a psychologist at a nonprofit organization called Fawzia Sultan Healthcare Network. I see clients, but I also do community outreach and I provide support for corporate wellness programs. And one of the things that I've seen is just in these last 3 years that I've been working there is such a high demand. People are always asking to have lectures or workshops or just activity days where they either want to learn about mental health topics or corporations want to provide these services for their staff. I'm really, really liking this openness and also the engagement. Again, coming back from that idea where I just said that people think that there's a stigma, but I've also seen that when people come to these gatherings, they're ready to talk. Right. So I think that just showing that there is an opportunity to speak, there's a space where you can be heard and not judged. I think this is really welcome. And the more that we can do this, then the more acceptable it's going to be for people to seek care on their own.
So that's interesting. So you work for the clinic and it's like 3 parts. One part of the clinic is like therapy, psychology. The other is like working in communities. And the third part is providing education for organization. And this is all under one clinic. And then it sends the therapists out.
Exactly. Yes. So the main reason why I joined the organization was that I was hired as a psychologist, but I'm also their outreach coordinator. So this allows me to get in touch with a variety of groups that are here in Kuwait. And also I have like businesses and organizations reach out when they say that they want to have a wellness workshop for their staff. And so I get a chance to see that as well.
I love it that it's all under one roof. This is what I like.
Yes. Yeah. So, I mean, that's also one of the things about this clinic, that it is, very multidisciplinary. So we also have pediatric care, we have neuroelderly care, and we also have a huge physiotherapy department because, there's this mind-body connection. So it's really great in the sense that we're able to provide care from all angles. And up until just very recently, we were doing psychotherapy only, but now we've opened a psychiatry clinic as well. The team members can collaborate to make sure that we provide the best type of care for the clients who come to see us. What I have found to be very personally uplifting is also when, let's say, a physiotherapist will refer a client to me and they'll say that this person has had chronic pain and they've been receiving treatment for, let's say, a year, but we think it's time for them to come and see a therapist. And then we can see how it all works together, how it is true that our body holds our memories and that sometimes we need to de-stress like mentally in order for our body to relax as well.
What is your society teaching about child-therapist relationship? And whether these values of society also influence how you design your interventions as a therapist?
This is a bit of a tough question, but I think that the simplest answer would be that I think the main thing to remember is that what underlies all the relationships is the stress on respect. Now, that being said, so you were asking about the child-parent relationship, right? So, I mean, that respect is going to be the foundation. But I think what's really interesting is that when it comes to therapy, there are so many other aspects that we need to take into consideration. In Kuwait, it's traditionally very family-oriented, and this is definitely something that's central to the cultural landscape. But at the same time, I think it's important to remember that culture is very, very complex. So I think one of the things that therapists need to remember is that we can't assume something about a client's values, their practices, or traditions. So just because somebody is Kuwaiti doesn't mean that this is it. This is what the formula is, right? Every single person is going to come with their own experiences and their own background. And so when it comes to, again, this child-parent relationship and what's being taught at home, I think it's very much going to vary depending on who the family is and their own value system. This is really something, again, that was kind of echoed in the research that I did about identity and belonging. And I think that this is an important part to emphasize because within the therapy session, we want to make sure that we're not assuming. And then this directly has an impact on the interventions that we choose. Right? So it's not going to be that, okay, I'm dealing with a person from this cultural background or this nationality, so I'm going to follow this method. It is very much about the individual who's in the room.
You also mentioned you work with the communities. I want to understand more about this community part, also in culture, how important community is. And also then as a therapist, do you approach the whole community, the whole family system, let's say, or you work with individuals? How does it work?
So within our clinic, we'll have different therapists with the different areas of expertise. So for example, I just work with older adolescents and then going onward, so ages 15 and up, and mostly on an individual basis. That being said, there are also other therapists who will see the family. So if I feel that, let's say I'm working with a teenager and the parents also need to be involved, maybe I'll do a little bit of work with them, but then I would probably refer them to another therapist to look at that. The same thing with couples counseling. One of the things that I've had an opportunity to do here is run a dialectical behavior therapy group. So I've done it just for adolescents, and then I've done it as part of our intensive outpatient program for adults. Again, it's been interesting. This is kind of linked back to what you were asking about, like stigma and how is, psychotherapy viewed. I think even as a clinic, maybe we're a little bit apprehensive that will people want to come to a group, right? This is the same thing when we have community activities. Say that, are people going to come and want to talk about their mental health? The short answer is yes. They will absolutely come. Maybe they'll be a little bit apprehensive. It may take a little bit of like reassurance, which of course they're going to want to make sure that they're safe, that their confidentiality is maintained, which is very, very important for us. But the main thing is that once they realize that we're ready to hear them and they have a space where they can work through their issues with other people and not be judged and being kind of accepted as they are, I think that process in itself is very therapeutic.
And how international is Kuwait?
It's very international. I would say it's about 65 or 70% non-Kuwaitis here in Kuwait, even in our client base and just with the therapists that work. So we offer services in English, Arabic, and I think French, and maybe a couple other languages, depending on what therapist is proficient in. And even the workshops, we'll ask people what language they would prefer, and we do them both in English and in Arabic.
Mm-hmm. So basically, cultural sensitivity is somehow already built in the therapist.
Mm-hmm. Yes, for sure.
What are the learned beliefs regarding client-therapist relationship, and can the relationship continue outside the therapy once the therapy process is over?
One of the things that's emphasized a lot is this importance of holding this safe, non-judgmental space for clients. And a key factor to this is maintaining confidentiality. We want to make sure that the clients know that they're completely respected and that we understand this cultural sensitivity part. As much as we do care for our clients, the relationship has strong professional boundaries. So any relationship outside the therapeutic setting is definitely not allowed while the treatment is in progress. And it's really not encouraged even after the treatment is over, without waiting at least a few years. Again, there's no hard and fast rule, but it is something that is frowned upon. One of the interesting things about being in Kuwait is that it's a very small country. Right. So population is about 3.5 million, but the country itself is tiny. And the chances of running into one of your clients is, I wouldn't say it's high, but it's there. The possibility is there. So one of the things that I discuss with my clients in the very beginning is about this potential situation, that how would you like me to handle it if we run into each other in public? So I usually tell them that I will leave it completely up to you. If you want to come up and say hello to me, then that's fine. If you don't want to, then that is fine as well. But I will not approach them first because I want to make sure that I maintain their confidentiality and respect their privacy.
Mm-hmm. And in case of therapeutic abuse, so that the therapy is the one who crosses the line, where can the client turn to? Is there any organization, or what can a client do?
I think in this case, I mean, luckily this, at least as far as I know for us, it hasn't happened, but I would hope that they would go directly to our organization, like the therapist supervisor, and just speak to them directly about such a situation. I know that for sure in our clinic, that would be handled very, very seriously. And in Kuwait, there is overall a Ministry of Health. So it's usually that the government clinics are operating under the Ministry of Health, but we are also a branch of that. So I believe it could be escalated more if it was a serious violation.
And is supervision a must for a therapist in your country?
As a country, it's not mandatory. However, in our clinic, especially for junior clinicians, it is required for the first year, and then it's very strongly recommended throughout the time that you practice. One of the things that we have at our clinic is a weekly case conference where we gather and we can share any cases that we are either struggling with or that we would just like some input. And again, as kind of a new psychotherapist, I found this to be really helpful because it's not just the first, second, or third year therapists who are sharing. Therapists who have been there for decades, and they are also sharing their cases. And I think maybe this really resonates with the constant learner inside me, which is it just shows that we're always learning, we're always growing, and that it's never an issue to ask somebody for help or assistance or get an outside perspective. I think that this makes it really approachable as a profession, that you know that you will be supported.
The seventh question, What are the most common complaints that the client comes to therapy for?
From my experience, I would say that the most common complaint has been being overwhelmed with anxiety. And I think this links back to what we were talking about earlier in terms of trying to find that balance of who am I? How do I fit within my family dynamic, with the cultural expectations and traditions, particularly when young adults are trying to find out who they are, right? And they're trying to search for their independence. But at the same time, because it's such a family-oriented society, how do you balance that with obligations that you have, towards your family as well? So I think there can be quite a bit of anxiety surrounding that and just figuring out, who am I? Where am I going? What does my life mean? These kind of questions.
And as a nation as a whole, what are some maybe collective traumas?
Well, the first thing that comes to mind for sure is the 1990-91 war. So starting with the invasion in 1990 and then the war that came after that, I think that's had quite a bit of impact. I wonder whether the lack of access to therapy or even just the idea of going to therapy during that time has had an impact. I mean, haven't read any studies or anything about it, but I do believe that when I think about my parents' generation and even my generation, I'll get together with friends and we'll still talk about it. And it's been decades. So it's definitely had an impact. I don't know if that's been addressed enough. It would be something interesting to further explore.
Do you mind sharing a little bit more about your experience, what you went through?
Sure. So it was August 2nd, 1990, and it was in the middle of summer vacation. So a lot of people were actually outside of Kuwait, and I personally was one of them. I was visiting my grandmother in Bangladesh, and my parents and younger brother were here in Kuwait at the time. And ironically, on that day, on August 2nd, I was headed back to Kuwait. And I remember, since we lived very close to the airport, we were just waiting until the last minute. I was traveling with my aunt. So we were waiting until the last minute to go to the airport when my mother called and said, "You can't come back because the airport has been bombed." And I was 14 at the time, so it was definitely a shock for me. I didn't know how to process that. And that was actually the last time I heard from my parents for about 2 months because all the lines went dead. I just couldn't get in touch with them. So it was pretty scary, to say the least. And I think I experienced not feeling at home in my home country for the first time because I never lived in Bangladesh. So suddenly I was a foreigner in my own nation. That in itself was an adventure. Luckily, my parents were able to catch a refugee flight out, and so we were reunited, and that was very emotional. And it was something that we definitely thought about and talked about for a very long time because we had to experience the splitting of family, the unknown, right? The uncertainty of, are we going to see each other again? Are we going to go back? And that's also the time when the idea of home was very much reinforced for me because all I wanted to do was go back to Kuwait. I didn't know Bangladesh, even though I was Bangladeshi. I wanted to go home. And so when we were able to come back, and we were one of the first or very early families to return to Kuwait. And I remember flying in and it was just dark because of the oil well fire. So the skies were completely black at the time. I mean, like if you went out in a white t-shirt, it would be black when you came home. You know, it was like that. But slowly over time, I also got to witness the rebuilding of Kuwait and to be part of that second phase. But there's so many things that you just never forget. You know, that phone call and the flight back in. We went to our house and it was completely empty. It had been ransacked. There was kerosene all over the place, you know, so you remember that smell, you know, all of these things kind of come back to you. And it's kind of hard to think that I'm sitting here in 2024, still in Kuwait, and, you know, like all of these things, it feels like it was just yesterday.
Yeah, I feel like crying.
It was an emotional time. And to think about at that time, you know, we didn't have email and WhatsApp and or any of these things, right? So have no idea whatsoever of what's happening. And again, as a teenager, of course, I'm thinking about my family, but I'm thinking about my friends as well. Like, where are they? We've just been scattered literally around the world, stuck wherever we were. And, you know, there's some people that I never saw again just because our paths have never crossed again. And at the same time, I remember my best friend at the time, somehow through Facebook and everything, we got in touch, and she was living in the States, and I saw her after about 25 years. And it was amazing because you have that bonding experience. Even though it was a tragedy, you can just never let go of that.
Yeah.
Mhm.
And from psychological mental health perspective, what do you feel the people are carrying with them?
I think from that experience, there is this idea again of loss. Suddenly, it literally happened overnight that the country was invaded. Knowing how fragile life is and how uncertain things can be, I think that's something that stands out quite a bit. I think that it's not always easy to know what to do with that uncertainty. I feel that sometimes we've gone to the other end of the spectrum where people want to live, right? They want to buy nice things, that they want to live a good life and all of that. Like, it's like, if I'm here and the risk of losing everything could happen just like that, then let me live life to the fullest as much as I can. At the same time, I think that comes with this illusion of happiness, that will material things actually make me happy? Or can I find it within myself in something more meaningful? I think the short answer would be that it leaves a lot of confusion in terms of figuring out, again, identity. Who am I? Where do I belong? And where is home?
If you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
I think I may be a little bit cliche with this, but I'm going to say that one of the most essential things is for you to have your own self-care practice. I think some people may see, you know, the job of a therapist as someone is just going into a room, sitting down and listening, and that's it. But my goodness, it's so much more than that. I mean, I think that the education I received was amazing, but there's nothing that can prepare you as much as being in the room and having a real person in there sharing their life with you. You know, you open yourself up as a therapist to hold that, right? You hold their grief, you hold their worries, their trauma, their stresses, and that over time gets heavy. Right. So I think in order for you to be a good therapist, then you have to make time for yourself. Absolutely. Self-care would be my number one thing. Whatever it is for that individual person, I think making that a priority is essential.